Hi, everybody. Okay, so I had surgery and I had the coccyx removal and I had the discectomy, which is where they go in and they do the laser surgery on your spine. I had my L5 and S1 done. They go in and they do the surgery, and then I had my tailbone removed because I was in a bad accident, so it needed to come out. It was at a 90-degree angle. So I just wanted to give you a little bit of information after the surgery. This is the day after. I'm up, but it's definitely painful. The incisions, you can definitely feel it. Follow directions 100%. What I did, I have an entire, I don't know if you can see the full thing. Everything that you can possibly think of to keep things as clean as you can. You want to keep it very dry. Go get at a medical supply place, they have it's a shower, almost transparent shower guard, so this way you can actually take a shower without it worrying about getting it wet. The other thing that I'm going to tell you to do is 100% go get one of these. This is a raised toilet seat with handles on it, and I got it from Walmart, and I went into the pharmacy section because they don't have it by the normal toilets, but that will help you not bending over, because you don't want to do that because you'll rip the incision open. Take Motrin. I take 800 milligrams of Motrin. They did give me a narcotic, but I don't take narcotics, and I don't want to get sick and then have to get up every so often. Walk very slowly. Take your time doing certain things. Just rest. Your body is going to be in a lot of pain the day after. Like, I woke up in the morning, I was like, hey, it's not so bad. My back pain's okay. Throughout the day, it started to get a little worse. So I would say probably, I don't know, I would just say try to relax as much as possible. Keep the incision completely dry, and just take it easy. Don't try to do things, don't bend at all, especially where you had your spine surgery. Um, it's minimally invasive, but they're still cutting through bone, they're still using a laser, they're still going in your spine. So just make sure you take it easy. Take the time off. Allow yourself at least a month off of, I would say at least a month off of work. Don't try to exceed that. Don't be Superman, Superwoman. 20% of people re-injure it. And as far as with the bathroom, if you have to use the bathroom, I use baby wipes, and they have aloe, and wipe forward. So this way you don't ever put any particle that way, because the biggest problem with this particular surgery with a coccyxectomy, which is the removal of your coccyx, is infection, because people don't keep it clean or whatever. So you want to make sure that area is always clean. So I do that, and then I don't use toilet paper at all. I use the baby wipes, and then I put a little bit of sea breeze on it, and just kind of keep it really clean after the final wipe. And then I wear, my underwear over it, and that's it. But just keep it very dry. That'll help with not having any infections. And I'm just trying to think. Anybody who's helping you out with the wound, just make sure that you got the particular things that you need. Like we got gloves, and this I got at the pharmacy, and it's like a soap. Oh, it's backwards, I guess. So it's a soap that you use to bathe your whole body. So this way you're just really, really clean. You don't have to worry about it. But you've got non-stick pads, and you have these, whatever. But make sure you have a lot. But yeah, these are the baby wipes, that I had. So just make sure that you get those few things out of it. But number one, I'll be honest with you, as weird as it is, I don't know if I can even show you this seat right here. This seat is a godsend. So get it. It's $34 and it's completely worth it. Yeah, that's just one of those things that you can't live without if you've had this surgery. So that's pretty much it. That's my update now. It's 24 hours after the surgery, and I'm okay. I feel like, as far as the pain from the actual surgery with my lumbar, that pain is gone. It's like a new pain because it's like a healing pain. It's not, my sciatica is completely gone, which is the craziest thing to me because I was suffering from that for a long time and it was horrible. Um, and obviously I haven't sat much, off to one side, used pillows, but I kind of put my leg up almost Indian style, but only one leg, and kind of lean over to the side like I've been doing for 9 months now with this injury. But I guess the best thing is just take it easy. Don't rush to be back in the swing of things because you could re-injure everything and then be worse and then have to go through even probably more in-depth things. So you don't want to do that. You don't want to risk infection for it. And it's weird because I was looking up videos to see how people, how everything was afterwards, if they've done this surgery or whatever. And it was like, there was a couple updates, but they didn't really inform you. So the other thing that I want to do, I had an accident and there was a few injuries that took place over the matter. I had a back injury and neck injury, my shoulder, my knee, and all this other stuff. And I never took too much time to pay attention to me when I was sitting that it hurt so bad to even get up. So as the time progressed and my back was getting worse, my neck was getting worse, my shoulders, my knees, everything was getting worse. I wasn't able to sit. And it went on like that for 6 months, 8 months, and then 10 months. And I said, I can't do this anymore. So I went to my surgeon and he did an MRI on that pelvis area, but I have to tell you, it does not show your coccyx, which is weird. It'll show it, but it doesn't show it if it's actually injured. Mine showed up a little white area, so they thought maybe it was a tumor or it was some type of hematoma with blood, might have gone to there. And that wasn't the case. I thought I was going crazy because all the reports kept coming back that I was normal, that everything was fine, and I knew otherwise. And if somebody actually had a video that posted up of ways to look for certain things, I probably would have cut 8 months of torture out of my life in doing so. This is what it's for you. This whole video is for you because I needed this video and I didn't have it at the time. So I'm giving you my knowledge. So after doing the MRI and it showed everything was normal, I insisted on getting a CT scan. The difference between an MRI is front and back, where a CT scan is a 360. And I knew when I was sitting down, I could not go from a sitting down position to standing up. As a matter of fact, I had to lean completely forward for about a minute and then I was able to stand. So if you have that pain or you had an accident, and even if it's years ago that you fell on your tailbone and you're just like, oh my God, it hurts so bad, it could be broken and it will eventually heal. It takes a long process, but if it's anything like mine, I fell through the ground. So mine hit really hard and then it just fused in a 90-degree angle. So I was just suffering with that for almost 2 years, but it really got bad the last 9 months. So actually my husband requested to get a CT scan because the MRI was just front and back and it just didn't show what he wanted to see. So we got the CT, and as soon as they flipped it to a certain degree, there it was. My tailbone coccyx was at a full 90-degree angle. And unfortunately, my doctor doesn't even do those surgeries. He didn't even know really where to start. So I did a lot of research, and I will have to say, and I'm going to blast this name on top of rooftops if I can, Dr. Scott Katzman. Okay, remember that name if you have any type of tailbone injury or back and your doctor's telling you need major surgery. Don't do it before you get the consultation with Dr. Katzman. And I'm saying this because you can send over, and he's in Florida and New Jersey, so you can send over to his office your MRIs. And if he believes that you're a candidate, and they take insurance or LOPs or whatever, mine happened to be an LOP, but they take insurance and they take, whatever, they'll read your MRIs and your CT scans and everything for free. And if you happen to be a candidate where he believes he can help you, which I think he can pretty much help everyone with the education behind his belt and the technology that he does, is I was up for a very major back surgery, open, the fusions and everything else, and in the long run I really didn't need it, but I did need my tailbone removed, which didn't seem to be even a person around, let alone in Florida, that was able to do it, until I came across Dr. Katzman, who I can't even tell you probably saved my life. So definitely look it up. If you're suffering at all, herniated disc, all that other stuff, you might not need to go through the infusion. And he could do this with laser. And I have no scars. I mean, I do have a pretty decent incision, but I'm standing, I'm up, I'm walking around, and it's the day after. I'm in pain, but I'm not. It's a different type of pain. But look him up. He's amazing. I was in and out in less than 2 hours, and I was able to walk out of there and came home. And I mean, the whole facility was just out of this world. I went into the Boca Surgical Center, and I can't even tell you how amazing it was. So if you're having any pain, go see him. You don't have to say that I referred you, but you gotta go. Don't settle on someone telling you that you need major back surgery, because if you could do it minimally invasive, then do it. And as far as, like I said, with the coccyx removal, you just got to keep it dry. You want to do everything impossible to just maintain the dry, get baby wipes, and always, after you wipe, always wipe forward, even though it's kind of gross and we're not supposed to, but wipe forward until, it's clean. And then I use sea breeze on the last wipe, and I just make sure that everything's, it's antiseptic. So again, if you feel like you're having tailbone pain and you just keep getting, even it was weird, even my CT scan, the report actually came back that everything was fine. But when the disc went in and that degree was turned to that, I think it was 85-degree spin, and he saw it, it just changed everything. So don't go by reports either. Don't let your doctor just simply do the reports. If they can't look at a disc and find something, go to another doctor. But definitely, I will tell you, Scott Katzman, Florida or New Jersey, go see him. He will save your life. And like I said, mine was from a really bad accident, but even if yours isn't, it doesn't even matter. Go see him. Get a second opinion, because that one is going to save your life. So, like I said, never settle for the first doctor who tells you that you're going to have major surgery. Always insist on getting more tests done. MRIs are great for herniated disc, but if it's a tailbone thing, request a CT scan no matter what. You can also do an x-ray in the sitting down position, but don't let them do the x-ray sitting down where your back is faced. Have them turn you to the side, because if you're sitting down and it's all angled to the side, they're not going to see it backwards. It's just going to show that it's up. And that came back normal also, but when they did it to the side, it didn't. So get that CT scan, get help. There's no reason why anybody needs to go through this pain. And like I said, if you're in New Jersey or you're in Florida, Scott Katzman is going to be the person you want to go to. He's just amazing. His office is amazing. They got one in Hollywood. They got them all over, but Scott Katzman, he's just amazing. I believe I owe him my life right now. And have a good support system at home. It's very important. Take the time off of work. Heal. I hope this helps. Any comments you want to leave or any questions, I'll periodically come back and look, and I'll answer them for you if you want. I did not do any narcotics, obviously. In there, they gave me a pretty strong pain medication, but as of now, I'm strictly on Motrin 800, and that's it. So I'm up and around. I'm sore, don't get me wrong, but I'm not on any narcotics. So I hope this helps. And like I said, if you have any questions, I don't mind answering any of them. So just leave a comment below, and I hope this actually helped you, because when I needed it, it wasn't out there for me. So good luck, and I hope you find a road to recovery in all your pain. Thanks.